Well, good afternoon, everyone. I was just sharing that we're having some fun with Microsoft Team links. Hopefully, you've been able to find it. If you are clicked in and you're in the back room with us, there's a link in our chat back here. If you're on the live side, welcome to today's webinar. As you know, we are doing our monthly workplace mental health focus with our Department of Labor. I'm Sean Egan. There's a Q&A box at the top of your screen. You can submit a question at any time. Today, you only get to talk with me. I hope that's okay for everybody, but we wanted to do a couple of things because we have some big news coming right around the corner. So we wanted to kind of share with you all sort of where we've been, what we've been doing, and where we're going over the next couple of months and hopefully the next few years, with continuing to develop out resources and tools that we can use to create better, stronger, more resilient, more healthy workplaces for working people across the state of Michigan. If you haven't already, please make sure you go to michigan.gov/workplace mental health. Sign up for our emails there. That'll get you all the emails for the information that we put out. It'll also, that's where we put all of our recordings and our reports, as well as a new report I'm going to talk about in just a little bit. Over the next couple of weeks, we should be seeing that. And anything you do or that we do, you'll be able to find there. So that's definitely something that you're going to want to have access to. So over these last 3 years, and I'm going to talk about how we got here, we've really kind of started focusing in on 3 pillars. So those are things that are happening in the workplace, things that are affecting the workplace, and then connections to individual behavioral health support. And we really believe, after this amount of time and the discussions that we've had and the things that we've learned, that it's really putting all of these pieces together that are going to make the real difference for us to create those types of workplaces that we need and want and expect across the state of Michigan. So how we got here started in 2022. During the governor's State of the State address, she talked about mental health, and she was largely talking about community mental health resources. But as a Department of Labor, we thought it was important to take a look at workplaces. So we put together a big group of folks from big business, small business, labor unions, psychiatrists, psychologists, organizational psychologists, and a few others, and spent a couple of months just kind of digging through data. Most of the data is national, but Michigan's kind of right there with the national data, so we didn't really find any reason to believe we were very much different in either direction. And in June of 2022, we put out our first workplace mental health report. We were a couple of months ahead of the U.S. Surgeon General, who data and information really was lined up with ours. So that made us feel real confident about the work that we did and the information that we put together. And since that time, we've been implementing the recommendations that came from that work group. And I'm going to share what some of those were and some of the things that we've been doing both internally and externally to kind of follow through on those recommendations and where we still have work to do. But the other thing we wanted to share with you all today is a sort of rebranding of this phrase, workplace mental health, where we're putting those 3 pillars together. Remember, that's the in the workplace, affecting the workplace, connections to individual behavioral health support. And we're putting those into what we call healthy work, healthy mind, because we want to show the symmetry and the synergy between those 3 pillars and how important it is that we focus on all of those. So this lines up with a lot of what you're seeing in what's called total worker health, where we're really looking at not only occupational safety and health, but psychosocial safety and health, as well as all of those other pieces. So you're going to continue to see this put out there, but it's helping, we hope, to get people starting to think about the sort of circle of life, so to speak, and how all of these things are connected and they have a big impact both individually and cumulatively on our overall health and well-being. So look forward to that, look forward to seeing it, and you're going to see us talking about that from here on out. We're going to be talking healthy work, healthy mind, and that is part of our workplace mental health strategy. So back to our original report, we have 9 recommendations from the work group, one of those being to make the state of Michigan as an employer one of those model employers that people could look to. So over the past few years, internally, we've done some things like implemented some training on mental health first aid certifications across many people within the department. We've done a mental health intro training for everybody, available to everybody across the department. We've done some stuff around the 8 dimensions of wellness that SAMHSA puts out to kind of help people build a plan for wellness that focuses more holistically. And we're continuing to look at and make changes to improve our overall workplace mental health and our overall workplace so we can be more productive, more effective, less burnout, and many of the things that go along with that. Some other things in those recommendations included creating a learning center, so that michigan.gov/workplace mental health is really our landing page where we put resources, tools, all of our videos and content is available there. And anything we're doing is going to be on that page, as I mentioned. We also kicked off our monthly webinar series that so many of you join us for all the time. We're so thankful for that. And we've been doing them for the last 3 years, pretty much every month. And as you know, we bring on different experts to talk about different topics, really focused around those 3 pillars. And we've been trying over the last year to really focus in on sort of 3-part series, which you've been seeing in your emails, where we're talking about sort of what the challenge is and what you can do about it. First couple of years, it was really kind of highlighting different challenges that are seen across workplaces in the state of Michigan these last year or so. And moving forward, we'll really be focused on kind of that 3-part concept of this is what it is, and these are some things that you can do about them. Part of what we're talking about over this 3-part series is how we are going to get further into workplaces to kind of create intervention tools and models that can impact workplaces more collectively. So we're really excited about that. But we have more work to do. Some of the other recommendations, we're breaking into industry clusters, creating better data tools, developing some Michigan-specific pieces, maybe looking at how we do different contracting or different grants or different opportunities. So we're still building out those different pieces of where we want to go. But first and foremost, as a Department of Labor, in the many presentations that I've done, which we're really proud of, over the last 3 years, I think we've had over 300 presentations that we've done across the state of Michigan to both employers and employees. Our numbers, just sort of guesstimating, is that somewhere around 10,000 employers we've talked with, and somewhere around 20 to 30,000 working people in the state of Michigan that we've talked to either virtually or in person. A lot of that's been in person all over the map for the state of Michigan. We've also been talking with experts on kind of where we're going. And as a Department of Labor, we are staying really, really close and focused to this concept of stress. If you've heard this from me before, you're going to hear it forever and ever, no matter what, because it was so eye-opening when we launched our report and did this work with those experts, how we are all wired to deal with stress. And what is kind of cool and allows for good conversation around this concept is that everybody joining us today, everybody is wired to respond the same way once that stress response activates. Now, we might have differences on when that stress response activates for us. We may see the same thing, and maybe I have a stress response and maybe you don't, but there's a reason for that, and I'm going to talk about a little bit too. So in essence, the stress response is controlled by this amygdala in the back of our brain. It's a small almond-sized part of our brain that really controls that. What we're used to is that fight, flight, or freeze response. It activates the hippocampus regions and actually weakens, or what I like to say, because I'm also an electrician, is it sort of short circuits the logic center. So that thing that makes us really cool, that rational, logical reasoning that we can do, isn't fully engaged when we're in the stress response. So we get some immediate effects, but there's a reason for this as well. It's, in essence, an evolutionary tool that helped us stay alive from that proverbial bear in the woods. And everybody's heard me talk about this bear in the woods. If we see a bear in the woods, more than likely we'll have a stress response. I know some people on here will be like, no, I wouldn't, because I'm used to that stuff. But for the purposes of discussion, the goal here is to recognize that the intent of the stress response is to keep us alive or safe from real physical threats to our health and safety. That could be a bear in the woods, it could be a virus, it could be bad food, it could be a lot of different things. It could be a whole different things, but it's intended to kind of help keep us alive. And that hippocampus region is where we have our emotional center as well as stored memories. So when we think about things like adverse childhood experiences, different types of experiences that created an inordinate amount of stress or created bad outcomes or created different situations, like that's where those are going to live. So when we think about like post-traumatic stress disorder, all of those types of things, those are having an impact on people. And as we all know, reacting emotionally often isn't the best way for us to get ahead. The challenge with the amygdala, though, and on this wiring piece, is that the amygdala never evolved further. So it doesn't really recognize the difference between that real physical threat to our health and safety and the big pile of work that you just got dumped on you, or the stuff going on with your kids, or the whatever, you know, like all of these different situations we encounter every single day can trigger that stress response. And as I always share, The most important thing to remember when we talk about the stress response is that it is automatic. It's an automatic bodily response. Both your logic center and your amygdala are connected to your eyeballs, and the amygdala gets information first. So we can actually have a stress response before we had time to even think about it. Now, we all know that some stress can be good. I always, my joke is always, if you tell me I have 3 weeks to do something, when am I going to get started? Hopefully everybody's laughing and you're thinking probably a couple weeks from now, because stress can help us focus. But when it becomes pervasive or chronic, that's when it starts to become more of a challenge for us. But in that automatic moment, when that stress response is happening, we can have things like brain fog and confusion can cause us to lash out, that fight response. It can cause us to shut down, that freeze response. It can cause us to try to avoid the situation, that flight response. It can have all of these immediate impacts on us, make us numb, make us irritable, make us do a lot of different things. And if it becomes chronic, because you're getting adrenaline and cortisol rushing through your body to get you ready to get away from that bear in the woods, it's enlarging your organs, making your heart beat faster, inflaming everything. You can have real physical health outcomes from chronic stress. That would include things like hypertension, heart disease, obesity, metabolic syndrome, arthritis. It can push people into addiction, like to alcohol, nicotine. You know what? You can be addicted to anything. It could be too much exercise, could be anything. So it can push people into that. But the most common outcome is anxiety and depression, and it's anxiety and depression. So a lot of anxiety, some depression in those kind of outcomes from chronic stress. A couple of years ago, I read Stanford Medicine said that they thought they could link depression in our country to genetics in about 40 to 50% of the cases. And in addiction, they said maybe 50 to 60% of the cases. So that means there's a significant part, 40, 50, or 60% of those that are coming from somewhere else. And a big part of that is that stress response and this chronic stress that people are enduring. If you just Google burnout, you're going to see that a significant majority of the work, or not majority, a significant portion of the workforce is saying that they are burned out. The WHO identifies or defines burnout as an occupational phenomenon. In and of itself, it's not a disease, but it's a contributor. As this chronic stress is pervasive in our bodies, it's damaging not only our physical health, but our mental health. So we have some real challenges there. So as a Department of Labor, we're going to really kind of stay focused in on that stress and how that chronic stress is impacting us and some of the situations that cause it. But we're also focused in on these 3 pillars. So we have those things in the workplace. We know some things like excessive overtime, excessive workloads, night shifts to some degree, the lack of predictable schedules, some of these different workplace bullying and harassment, they have a stress impact on people and they are causing real challenges. So we want to talk about what's happening there. We also have to talk about what's happening with benefits. So when we started this journey, we've all heard about mental health parity. And I always perceived that to mean that medical benefits and mental health benefits were equal. What I've learned from a lot of employers is that's not necessarily true. So we're really out there talking with employers too about take a look at the benefits that you provide and let's see what's going on there. Because one early on that we learned about was like on the healthcare side, the medical care side, it was like a $500 deductible, sort of the traditional PPO type plan. But on the mental health benefit side, it was a $2,000 deductible before you even got to that 80/20 piece. The employer in that case recognized that meant his folks were not going to use that benefit and found a way to help offset some of those costs. But not every employer is going to be able to do that. But we do want to take a look at those types of things. Think about paid time off. Part of the way we deal with the stress response is we have to get away from what's causing the stress. So we have to find ways for ourselves to have breaks from those things that are aggravating and causing us stress to make sure that we give our bodies and our brain time to recover from the stress itself. But we talk a lot too, and we will not be the experts in this, but we are partnered with a ton of experts in this on things affecting the workplace. So all of us that have had different life experiences, and we're going to bring those with us wherever we go. So if you think about things like adverse childhood experiences, poverty, racism, gender discrimination, different types of trauma, post-traumatic stress disorder for our military folks primarily, but other first responders and other folks that have post-traumatic stress disorder, they're going to bring that with them. And in a lot of ways, that can sort of change the triggers on the stress response for people. and it can make it more difficult. So in our report, you'll see, like in Philadelphia, they found that women in particular that had 4 or more adverse childhood experiences had very high rates of job insecurity, financial insecurity, substance abuse issues, and other things because of that, uh, what they're carrying with them. So it makes it harder to get in and stay in the workforce. So when we talk with employers out there, I always share, I can teach anybody to be an electrician, but we still have to deal with what trauma is coming with people, because it's going to make them less likely to be successful if we don't manage that as well. And then we cannot lose sight of connections to individual behavioral health supports. We definitely want people getting connected to the help that they need. I think in our report and in our discussions, what we do talk about, though, is that a lot of folks are not going to go do that. So we want to bring in the concepts to the extent that we can, broaden the base for understanding of those, and try to get people to grab that help that they need, but recognize that we have to intervene to make sure that they understand that something might be happening. There's a lot of discussion recently on adverse childhood experiences, and I've been sharing with folks is that not only do we have to protect children, we have to help the folks that have experienced the adverse childhood experiences themselves, that are trying to be productive members of society and stay in work, because they're going to have more challenges to do that. So we have to actually look at holistically how we're going to manage those different types of things. And more recently, looking at sort of this concept of total worker health or just workplace safety. For anybody that does workplace safety, you are very familiar with this hierarchy of controls, it's called. And it's kind of how you manage physical safety hazards. So think of the chemical. The best way to deal with that potential hazard is to not have the hazard. So if you don't need that thing, don't have it around. Sometimes that's not possible. Sometimes maybe you can substitute it. In each of these cases, you're moving further along the line toward protecting workers from physical health and safety or illnesses, workplace illness or injury, based on engineering or hierarchy controls, which includes like engineering controls. That'd be like ventilation, administrative controls, don't go by the chemical. And then eventually PPE. Now, what's interesting on hierarchy controls is recognize that the personal protective equipment that we're also familiar with is actually the least effective form of managing the hazard, because what we're trying to do is give you shields from the hazard instead of trying to get away from it completely. Still effective, still functional, still works within our system. On that other side there, though, looking at it from a total worker health perspective, where we want to go is very similar on the hierarchy controls. And at the bottom there, some of the things we do around what we call wellness or things like that are very helpful, but they're not going to necessarily move the needle directionally the way that we want them to go, because we have to be thinking about both the hazard itself, as we do in workplace safety and health, as well as what's causing the stress, because resilience is very, very important. We want to ensure that people get the help they need, get the training they need, get the education they need, find ways to cope with the stress that they're having, but that alone is not going to solve the problem. So what we're seeing out there in the news nationally is a lot of people saying they're burned out, a lot of wellness programs being developed, but more people becoming burned out because we're not dealing with the cause of the stressor. So the experts, and what we talk about in our report and what I talk about everywhere I go, is that the experts told us building resilience is critical, but we have to deal with the stress, because if we don't deal with what's causing the stress, it won't really matter how resilient we become. They cycle together. And the example I normally use when I'm presenting anywhere is people living in poverty. Something we know about people that are living in poverty is they are chronically stressed. They're going to age faster, they're going to die younger, and they're going to have more chronic health conditions, largely because of that environmental and that poverty exposure that they're having there. So we can do a lot of things about managing the stress, but we have to deal with the cause of the stressor, or the outcome is not going to change for those folks that became more resilient, because they're both still there. So we really want to make sure that we focus in on that. So as we continue to develop out these tools to go along with this concept of stress and resilience and brain science and everything else, in about a few weeks, I hope, but pretty soon, we're going to launch a new report that we'll have our December webinar about. where we're going to go over some of the findings and the data from that report that's really going to dig in deeper to what stress does to us, what it's doing to our bodies, where we're experiencing it, which does include workplaces and our society, and how we have to try to think about dealing with those issues. And in the next webinar in November, we're going to start talking about what we call the LEADS program. So we developed kind of a framework that, as an intervention model, we're working with some great experts out there from different universities to help us figure out what the training pieces will be inside of this model. But we have developed what we believe to be sort of a linear concept around how we can have a better intervention in our workplaces, broad-based, good learning all around, that brings in those three pillars. And we're going to start with that L, that learn. So that would be assessing your workplace, look at your benefits, talk to employees, see what's happening in the workplace, then bring in that education. So that would be some of us, that would be some of our friends that bring in trauma-informed workplace bullying, other types of trainings that would be available in the workplace. Put that into action. So make those updates that you have, that you need. So act on it. Evaluate your work process and workflows if you can. Deploy those across your place of employment, and then continue to study it. So one of the challenges with all of the data is it's typically national. As I mentioned at the outset, we can extrapolate from that Michigan's really about the same, but we really want to know what's happening. So part of this assessment and LEADS process will be working to start measuring different outputs from the interventions that we do to make our workplaces work better for all of us and make our society stronger. So some of the things that we've seen in the research and some of the things that we're talking about are that you can see real big impacts for working people, both within the workplace by experiencing lower rates of burnout, avoiding that brain fog and confusion when we're dealing with the stressor, because from any kind of workplace safety and health perspective, somebody being at work with brain fog and confusion is very concerning. We talk a lot about the impacts of presenteeism in our workplaces, and people that are struggling are still going to come to work, but they're not going to be able to function at a very high level. I personally deal with that from time to time. I think we all do. You get a little bbit fatigued, you get worn out, you get burned out, and you're just not ready to engage or write or read or do the things that you need to do in the workplace in a productive, the most productive way that you can. So really how we can manage that. And we're hopeful that we'll start to see some real good progress in Michigan that really identifies those three pillars in the workplace, affecting the workplace, and connections to individual behavioral health support. So I hope I didn't bore you to death, but I think we're on a good path, and we're really excited about the work that we're doing here in the Michigan Department of Labor. As we have seen or continue to see, we're one of the few departments of labor in the country with this type of focus. We are getting more support from other state departments of labor. We're having discussions with anybody that'll listen, and we're continuing to grow out resources and tools so that we can start to have a really big impact in our workplaces and our society beyond that, because it does reach beyond the workplace in and of itself. So I'll kind of stop there, and I'll see if we can take any questions if we have those, and happy to do that. I don't know if I'm on my own today for questions or not.
Yeah, Sean. So the very first question that we have is from Kelvin Thomas, and his question is, I know several guys that are literally going through those type of situations. What can I tell them to help them grasp what's going on through the work on the job, trying to make deadlines?
Yeah, this is a big pressure piece for us all, right? So first and foremost, get them over if you can, or grab the information from our michigan.gov/workplace mental health page. Our report has a big section about sort of stress and what it's doing. I think for all of us that work for a living, we know that there are times where the pressure is high because the deadline is tight. When it becomes continual, pervasive, and chronic, it's going to cause some real challenges for us. So what we'll start to see there is more absenteeism and tardiness. About 40% of all job turnovers related to stress. So you're going to see more people leaving employment. You're going to have some more health problems. You could potentially have increased physical and workplace injuries and illnesses. So there are some real challenges there, but it's really about grabbing those resources. And if you go to the National Institute for Occupational Safety and Health as well, I mentioned that concept of total worker health a few times. They have some pieces there about the impacts of stress, as well as OSHA. OSHA, if you Google OSHA workplace stress, they have a whole landing page with different tools, toolbox talks, you name it, that kind of can get into how we have to manage stress in the workplace. It feels like we're getting smarter and stronger about recognizing that the limits of human capacity are limited, and that as we continue to put more and more pressure on people, their ability to function is going to go down and down. And it's because of all of that stuff that I shared with you at the outset on kind of the stress and pressure that people are feeling and what's going to happen for them if that is pervasive.
Thank you, Sean. So the program that you pretty much teed up during your presentation, they want to know, was this program developed in consultation with any mental health professionals, academia, employee representatives, like who helped create this?
Yes, yes, and yes. So a large part of the group that's been working behind the scenes, the LEADS concept actually sort of came out of our original work group. We didn't include it in the report, but it was kind of creating that flow. So we had all those employers, employees, psychiatrists, psychologists, organizational psychologists. And as we've developed what the actual interventions will be, we've been working with organizational psychologists, actual psychologists and others to kind of make sure that we're putting in the right tools there, as well as folks that are experts in what are called trauma-informed workplaces and some of those other pieces there. We're definitely not starting from scratch. There's a lot of tools that exist out there, and we've been building all of this thinking about how we get these interventions into places where employers either can't afford to or just aren't at the point where they want to make these types of investments. So we're trying to deliver it from the Department of Labor.
Thank you, Sean. And we're kind of right up at time, so this is going to be the final question. How does this program align with LEO's, broader workforce development goals, employee well-being goals, or just basically the equity goals of the division or the department? I'm sorry.
Yeah, for sure. I think you could probably hear, as you asked the question, for those folks that don't really know our LEO goals, but it's to build a stronger middle class, to build a more equitable and equity-driven sort of society and that kind of stuff. So when you kind of hear through some of these concepts, those pieces about recognizing those things that are coming to work, how do we help the folks that have already experienced the adverse childhood experiences or had those types of situations that are going to cause more challenges there? How do we keep them in the workplace? We want to improve the recruitment and retention across the state of Michigan. The sort of labor shortages that we're all accustomed to hearing about in the news are moderately permanent because they're just the population of the country, not just Michigan, but of the country is kind of changing. So there's not a pipeline of younger workers that are going to come in and fill all these gaps. So one of the best ways to deal with that is to keep the people you have, keep them healthy and productive. We can increase efficiency of businesses by making folks stay healthier. So we want to make sure that we do that. So it helps us kind of hit a number of metrics within LEO. It helps us improve workplace injuries and illnesses too, which is also part of our MARIOSHA mission and our Department of Labor mission. It can help us reduce comp claims. It can help us reduce healthcare costs. It can help us do a lot of things just by having this kind of focus. So again, for today, I thank you so much for joining us. I hope you enjoyed today, just kind of a recap of what we've been doing the past few years. We're really excited and continue to push ahead as hard as we can to grow awareness, to grow understanding, to grow commitment in the work that we're doing. We're really excited about what you'll hear next month on what the LEADS program is more in depth and kind of what we're going to do in the pilot phase. And then we're going to, in December, talk about a new report that's very extensive on kind of what is going on for us with stress and other work characteristics and kind of how that's impacting us. So thank you so much for joining us today, and I will look forward to seeing you all in November.